Resident doctors are on a nationwide strike at a time when a pandemic is threatening the lives of thousands of people in the country. But the doctors say this had to happen as they blamed the government for exposing them to unsafe conditions during the pandemic. They lament that many of them have died from COVID-19 and at least 200 others have tested positive for the virus. Tessa Makende reports.
Empty walkways and wards in hospitals in Kaduna. The environments are also devoid of patients and resident doctors who most of the time take care of them. The doctors have joined their counterparts in other states across the federation in a protest against neglect. They are emphatic that this has led to the death of several of them and left others testing positive for COVID-19.
About 15 doctors, only doctors have died of COVID-19 all over the country. We've had over 200 that have tested positive to COVID and over 800 that have been exposed to COVID. So we find ourselves in an environment where we are unprotected. We go to work to offer our best, but then at the end of the day we get infected and so many of us have died.
The doctors are now demanding that the government meet its part of the bargain with them. But until then, they say downing tools make so much sense in the circumstance.
We're not safe, and that's the point. If you come and infect your healthcare worker, your doctor, the chances are that your doctor will see another person and that person gets infected. So these things, they form that's personal protective equipment. They act like a physical barrier between you and the disease.
The doctors say exposing them to danger on a daily basis when they have patients to attend to has been worrying. They say they are patiently waiting to see what the government would do after now. The accident and emergency ward here at this hospital is usually packed with patients, but that's not the story at the moment. And the doctors say the impact of the strike will be felt better in the days ahead. They want the government to honor the agreements made with them by making available personal protective equipment and, of course, providing their COVID-19 allowances, among several others. Tassam Akende, TVC News, Kaduna.